All right, it's Dr. Simpson here giving us stem cells for dogs, and today we're going to talk about joint pain and long-term treatment of joint pain. So, joint pain is basically arthritis. When the joints aren't aligned and there's damage either on the cartilage surface or in the alignment itself, where things are not moving smoothly, you get damage to the cells. You get rips in the cartilage, you get tears and stretches to ligaments. As that happens, that releases inflammation, which causes redness, pain, swelling, the basis of inflammation. So, when you get this damage that's occurring into a joint and the body has inflammation going on, the body's natural response is, I got to try to heal this. And so, scar tissue starts to form, you get fibrous tissue, things don't heal 100% just right because you're still using the knee or you're still using the leg, and now all of a sudden, it becomes more arthritis and more pain and more inflammation, and the process just kind of keeps cycling again and again and again. And so the goal of therapy for any kind of arthritis type management is to get in there and help, one, reduce pain, two, reduce the inflammation, and three, try to get the greatest environment you can for the body to heal and to regenerate, to heal properly. So, unfortunately, our dogs don't really listen to us when we tell them you need to strict rest for 2 months like you would for somebody that hurts their ACL. It just, they don't listen to us, unfortunately. So, you're trying to restrict them. You can limit their activity as best you can, but full restriction just normally isn't an option for clients. It's not an option for pets. They don't want it. In that same respect, because of the physics of the joint and how the joint is bent a little bit differently in dogs, and they are very active, putting braces on them doesn't really work either. Unlike us where they could put one of those water braces on your knee to keep it straight when you partially tear an ACL, they really can't tell a dog to hold still. You just can't do it. It just doesn't work. It's like telling a toddler to do so. It just doesn't work. So, the long-term management of those kind of things of using a brace on a sore arthritic joint doesn't really translate from human world into dog world. So basically, we're normally left with what are our long-term solutions? And for most dogs, it's long-term pain medications and anti-inflammatories. And sometimes nutraceuticals like glucosamine and fish oils help preserve the joint environments. And that's really all we had for our long-term maintenance. And obviously, a good exercise plan, a good weight loss plan, keeping a good healthy body weight, that all made a difference there. But when we start looking at stem cell therapy now for dogs as a long-term potential help for joints and arthritis, there's huge promise. So when we do one injection and one infusion, because of the biology and how it all works and how the stem cells recruit the natural body's stem cells to come into the area, while the stem cells we infuse only live for about 6 months, the long-term effects because of the stem cells they recruit to come into that area are much beyond that. So we're seeing that most of our patients, we do one injection and they don't need a second injection. Because the environment has changed because the stem cells have come in and they've altered the environment based on the different cytokines that they've released and the inflammatory process they've regulated. And then they brought in the normal stem cells to come in and help kind of heal the area and help with regeneration. So overall, you have this very dynamic environment that's been created, and so you get this more long-term relief. You get more long-term results with stem cell therapy simply because of the dynamic nature of the biology. Basically, you're helping the body use its natural way of healing to expedite healing itself. And so by doing that, we see this is a potential option for a more of a long-term therapy solution, which is wonderful. It works great too in combination with the things we've already been doing: weight loss, nutraceuticals, NSAIDs. It allows us to decrease some of our doses of our drugs, which obviously drugs have effects on the kidney, the liver, and other functions of the body. So the less that we can take, the better. So overall, we're seeing a huge difference in how we can manage our cases now in the long term for arthritis and general joint disease, based on the usage of stem cell therapy.